clinical practice, clinicians can often confuse Parkinsonian side effects with tardive dyskinesia. What are the key aspects that a clinician needs to keep in mind to differentiate the two?
It's difficult to distinguish one movement disorder from another one, particularly today when there's so little tardive dyskinesia. When I grew up in the conventional antipsychotic era, before the mid-90s, when a lot of these newer drugs came in, we had a lot of tardive dyskinesia, and people saw a lot of it, and they knew what the difference was. There's phenomenological descriptions of, if you call it dyskinetic, meaning rapid, jerky movements, often of the tongue and the lips and the face, oral, buccal, lingual. But you don't see a lot of that today, and you can see some in the limb, but that tends to be later. There's also dystonias that are kind of axial, if you will, in other words, on the midline, and they change the postures. That can be both Parkinsonian and tardive dyskinesia. So it can be difficult. I used to have a tardive dyskinesia clinic in the 90s and the 80s when I was in training before the new drugs came out, and those clinics are largely gone. So if you see something around the mouth, I would say that's an easy way to say, be suspicious it's tardive dyskinesia. However, the Parkinsonism is more common. Now, it is less common than it used to be, but it's more common than tardive dyskinesia. And what that means is tremor. It's usually a pill-rolling tremor, but actually that's not the most common thing. Parkinson's disease has that, and you can see some of that with these drugs. It's usually stiffness. We call it rigidity. And a little bit of what you call Bradykinesia. Brady means slow, kinesia means movement. So you people move slowly, and they look like this, and they will maybe stand up and have a little bit of a stoop posture, and they don't move very quickly. Their neck is that's a kind of a Parkinsonism. And when you see a young person that's 25 looking like that, you say there's something wrong with that. The other way is the hands, because the hands, if you look at most people have their hands kind of scooped a little bit like this. You'll see out like this some posturing. What is an important movement disorder that's the most difficult to distinguish, in fact, is really mild Parkinsonism, which is sometimes called akathisia. Akathisia can be confused for agitation because it looks like you're agitated. And what it is sometimes, is fiddling like this, see, with your foot going like back and forth, but it's a sense that you need to move, and then once you move, you're not satisfied. Some of us have that kind of feeling when we go to sleep. You kind of move, and then you don't really feel comfortable. You have to move again, and this kind of akathisia, restlessness, can be a part of taking antipsychotic drugs. It's really kind of a mild form of Parkinsonism. So akathisia, tremor, rigidity, and bradykinesia are this kind of pseudo-Parkinsonism that are caused by some of these drugs more than others, even the new ones. And then tardive dyskinesia is a complication of very long-term treatment, and particularly you can see it also when you reduce the dose or withdraw the drug.
Right.